I have like two patient stories. It's kind of interesting. The first time I started doing any health activism was actually years ago when, as a mother with bipolar disorder, the custody of my child was threatened. And I realized I had two ways to go. I could either let the court system and my future ex-husband walk all over me, or I could become a health activist, which would make it look really bad if they were to take my child away from me. And, you know, in the course of learning more and more about bipolar disorder, made me feel much more powerful about myself and what I could do as a mother. And then when I started working in my job, that kind of all went aside. And then when I later became ill again with kind of these mystery autoimmune symptoms that I didn't really understand, in the course of trying to get a handle on what was going on with me, and getting more knowledge together for myself and being on Twitter and tweeting about this, I realized that there were a lot of people who are afraid to ask questions for themselves, and they need someone to ask questions for them or do research for them. And then that kind of started my second sort of foray into health activism, and that was probably, now it's been 5 years, something like that. The What the Jules community, which is almost like this What the Jules persona of me as a blogger and as kind of a snarky health activist that isn't afraid to say pretty much whatever I want within reason, and talk about the things that a lot of people are afraid to talk about. I was able to start a blog and kind of attract either A, the same kind of person as myself, or B, people who were exactly the opposite, who wanted to have that kind of experience but were afraid to do it for themselves. And so putting the blog together, starting a blogging community and a podcast, and then later the Blogger in Residency program, where we could teach other bloggers to do the same, find their own voice, whatever it may be. It doesn't have to be the same kind of voice as mine, but just to find a voice and use it. Throughout that, the Chronically Awesome community was growing alongside of it until they merged and kind of became almost inseparable. And I realized that the attitude that I was portraying on the What the Jules community was really this attitude of Chronically Awesome, which was don't put the ill out there, put the awesome out there, and just be what you want to be, and don't let the illness stop you. Say what you want to say, and don't let anybody tell you that you're not allowed to say that online because you might offend someone, or, people may not want to look at you in your illness in that respect, which was always kind of my big thing, which is that I was never going to let anybody censor what I said. And I did get myself into a lot of trouble that way on many occasions, but I think ultimately it has served me well. Because there is such a giant gap between healthcare and the average chronically ill person lately, and when I say lately, that could be a decade, it's harder and harder for people to get all the little tiny bits of the puzzle that they need to get a complete picture of their healthcare managed. I think that's where we sat down and said it's going to take a nonprofit to do this. And it's going to take a nonprofit that doesn't just speak for lupus, it doesn't just speak for fibro, that doesn't just speak for MS. Because when we have a bunch of little tiny voices screaming, our need to the NIH, screaming our need to our local representatives, to whomever we need to, we're just like that little Horton Hears a Who. We're just like that little who on that little plant. And maybe only one big elephant with one big ear can hear us. But when we are all one voice combined, we will get so much farther, so that we can fill in all of those little puzzle pieces together. Because advocacy spread out is advocacy that is completely diluted. Advocacy that is put all together and in one strong voice will be much stronger and had much greater effectiveness. So that's really kind of that last bit of our goal there in combining all of the chronic conditions, is making sure that we have one loud, strong voice instead of all these little tiny voices coming from everywhere, and then nobody's quite sure who they should listen to. And I hope that more people take a lesson from what we're doing and realize that this isn't about a turf war and who gets this money and who gets that money. It's about all speaking together and working together, because we do all have very similar, in fact, almost exactly the same needs. I think you guys have been such, even when you don't know you're doing it, such a huge supporter of mine. Just the programs that you provide and the way that you encourage bloggers and health activists has really been a big catalyst for getting this done for me, because once you learn more and more about being a health advocate, then the next thing that you want to do is the next thing. And when you keep doing more, the next thing just becomes a bigger thing and a bigger thing. And this was the next bigger thing. And I thank you guys for helping me get to this place, because you had a lot to do with it. So I appreciate it.